The importance of a personalized approach to MHT. Not all women experience menopause the same way. Thus, MHT should not be a one size fits all solution. Factors such as a woman's health history, symptom severity, and personal preferences should be considered when deciding whether MHT is the right choice. This tailored approach helps ensure that the therapy aligns with the individual's specific needs and health goals. Midlife in Motion is a podcast for women who want to reclaim their metabolism, maintain their mobility, and recognize their divine worth. I'm your host, Angie Collingwood, fitness and yoga instructor, body confidence, and menopause coach. This show bridges the gap between science and soul. We move beyond quick fixes to discuss the real pillars of longevity. Get ready to start dancing into midlife. Welcome, amazing friends. Have you ever opened your browser, typed in the words hormone replacement therapy, and closed the tab 10 minutes later, feeling more confused, anxious, and overwhelmed than when you started? If so, you are in good company. Right now, there is a massive wave of conversation around hormones. The International Menopause Society and allied organizations caution that online and media misinformation often overstates the risk of menopausal hormone therapy or promotes it as a universal anti-aging cure. The consensus is that when prescribed appropriately, the benefits of menopausal hormone therapy may outweigh the risks for many women. But the sheer volume of misinformation and social media hype has left millions of women feeling fundamentally disempowered. We are caught between old school medical fear mongering and modern influencers claiming hormones are the magical fountain of youth. Misinformation often stems from misinterpreted historical studies like the 2002 Women's Health Initiative, which tested older women using MHT for chronic disease prevention. These nuances have led to a reevaluation of the risks and benefits of hormone replacement therapy, emphasizing the importance of context, individual health status, and timing when considering hormone therapy. Today, we are clearing the smoke. We are stepping out of the confusion and into evidence-based science. I am going to share what I have learned from my research. We will break down what hormone replacement therapy actually is, the vital medical considerations you must know before starting, as well as the pros and cons based on the latest clinical data. My goal today isn't to tell you what to do, it's to give you the health literacy you need to partner with your doctor and make the choice that is exactly right for your unique biology. Deciding whether to use menopausal hormone therapy, MHT, involves balancing significant symptom relief and long-term health protections against the specific risks for you. I want to empower you to make the decision that is right for you. So what is MHT, HRT exactly? Let's start by defining our terms. Historically, we've called it HRT. Today, major medical bodies prefer MHT, menopausal hormone therapy, because it isn't about trying to fully replace the hormone levels of your 20s. It's about strategically managing symptoms and protecting long-term health as your body transitions. At its core, MHT involves the administration of hormones, typically estrogen and sometimes progesterone, to alleviate symptoms such as hot flashes, night sweats, mood swings, and vaginal dryness, and to prevent medical conditions that are also more common in this phase of life, especially osteoporosis. It supplements the body's naturally decreasing hormone levels. During perimenopause and menopause, your ovaries naturally begin to deplete their follicles. As a result, your key production of key sex steroid hormones drops dramatically. Estrogen is a master regulator. It doesn't just drive reproduction, it stabilizes your brain's thermostat, protects your blood vessels from stiffening, maintains bone density, and regulates your metabolism. Progesterone acts as your natural neurological brake pedal, calming the nervous system and protecting the lining of your uterus. When these hormones fluctuate widely and then drop, your body's systems are thrown into chaos. The Lancet, one of the world's most prestigious peer-reviewed general medical journals, recently emphasized that we need to view MHT through an empowerment lens. Menopause is an evolved natural biological transition, not an endocrine deficiency disease that automatically requires a prescription for every person. MHT is a powerful tool, but it is just one part of an ecosystem that must include lifestyle, nervous system regulation, and metabolic health. They advocate for accepting menopause as a normal aging process and utilizing these lifestyle changes or cognitive behavioral therapy where appropriate. There is no one size fits all approach. The therapy should be considered on a case by case basis. The Lancet advocates open shared decision making between patients and clinicians to weigh individual risks, such as baseline cancer or cardiovascular factors, against the benefits. What to know before starting. If you are considering MHT, remember you cannot take a one-size-fits-all approach. Your neighbor's prescription might be entirely wrong or even unsafe for you. Before you book that doctor's appointment, here are 3 critical evidence-based considerations you need to understand. First, the window of opportunity. Timing is everything. Current cardiovascular and metabolic research shows that MHT is safest and most effective when started during the window of opportunity. This means initiating therapy under the age of 60 or within 10 years of your final menstrual period. When started during this window, the therapy actively protects your blood vessels and heart. However, if a woman starts systemic oral MHT much later, say in her late 60s or 70s, her blood vessels may already have adapted to low estrogen states, and introducing hormones later in life can actually increase cardiovascular risks. Initiating MHT closer to the onset of menopause, usually within the first few years, can be more beneficial, particularly in terms of system management and potentially mitigating the long-term risks associated with decreased estrogen levels, such as osteoporosis. Second, the route of administration, oral versus transdermal. How the hormone enters your body changes its biological profile. Oral estrogen, or pills, must pass through your digestive tract and be processed by your liver. This first-pass metabolism can increase inflammatory markers and slightly elevate the risk of blood clots or deep vein thrombosis. Transdermal estrogen, in the form of patches, gels, or sprays, are absorbed directly through the skin into the bloodstream, bypassing the liver entirely. The clinical data showed that transdermal options carry virtually no increased risk of blood clots compared to oral options, making them a preferred choice for many midlife women, especially those with metabolic or blood pressure considerations. The uterus rule. Estrogen versus combined therapy. This is a non-negotiable medical fact. If you still have your uterus, you cannot take estrogen alone. Unopposed estrogen causes the lining of the uterus to thicken, which can significantly increase the risk of endometrial cancer. Therefore, if you have a uterus, you must take combined therapy of estrogen alongside progesterone, preferably micronized progesterone, which is body identical, to protect your uterine lining. If you had a hysterectomy, you generally only need estrogen. The pros and cons. Now let's lay the cards on the table. What are the actual benefits and risks based on the current global medical consensus? Navigating the risks and the benefits. It is important to thoroughly evaluate potential risks and benefits and to have open, honest discussions with your healthcare provider. While MHT can improve menopausal symptoms and quality of life for many women, it may not be suitable for everyone, especially those with certain health conditions or a history of breast cancer. It's about making an informed choice, one that weighs the personal advantages against possible health implications. The pros of MHT. Relief of vasomotor symptoms. MHT is typically the go-to for treating hot flushes and night sweats. By stabilizing the brain's hypothalamus, it can eliminate the nocturnal spikes that disrupt sleep, which directly lowers the chronic cortisol stress that stalls your midlife metabolism. Genitourinary health. Declining estrogen causes localized thinning and dryness of vaginal and urinary tissues. Topical low-dose vaginal estrogen therapy is considered effective. Bone density protection. As estrogen declines, bone turnover accelerates, drastically increasing the risk of osteoporosis. MHT halts bone loss and reduces fracture rates, setting you up for structural strength and longevity as you age. It is often used as a preventative therapy for women at high risk for bone loss. Cardiovascular and mortality benefits. When initiated in women under age 60 or within 10 years of onset of menopause, MHT is associated with lower overall mortality and a reduced risk of coronary heart disease. Sleep and cognition. MHT may lead to small improvements in sleep quality. While it is not a treatment for dementia, it may improve memory and concentration in women who are also experiencing problematic vasomotor symptoms. Stabilizing hormonal baseline can reduce the wired and tired, irritability, brain fog, and anxiety associated with the perimenopausal transition. Libido. Testosterone, when added to conventional MHT, can be effective for treating low libido. The cons, risks, and limitations. The risks of MHT often depend on the type of hormone used, the delivery method, and the woman's age at the start of treatment. Blood clots and stroke. Oral estrogen can increase the risk of deep vein thrombosis or pulmonary embolism and stroke. Uterine issues. Inadequate progesterone dosing can lead to thickening of the endometrial lining or even cancer. Gallbladder and liver burden. Oral MHT is processed by the liver and can place an additional metabolic burden on women with non-alcoholic fatty liver disease or gallbladder issues. Symptom reoccurrence. Up to 50% of women experience a resurgence of symptoms like hot flushes after they stop taking MHT. The cancer conversation. Let's look directly at breast cancer. In a study in 2021, the highest risk for breast cancer when using menopausal hormone therapy occurs in women who use systemic combination hormone therapy, estrogen plus progestogen. The risk varies depending on the combination of preparations. Women with increased mammographic breast density are also at higher risk. In contrast, estrogen-only therapy prescribed to women who have had a hysterectomy carries a lower risk, and in some long-term studies, it could actually be linked to a decreased risk of breast cancer diagnosis and mortality. Medical consensus indicates that the individual risk profile changes depending on several critical variables. First, the type of progestogen used. The specific synthetic progesterone used in combination regimens significantly affects risk. Synthetic progestins carry the highest risk of breast cancer, whereas regimens using micronized progesterone or dihydrogesterone show a lower risk of breast cancer. Second is the duration of use. Short term, which is 1 to 5 years, the risk remains very low or negligible for women taking combination therapy. Long term, 5 to 10 plus years, risk increases progressively with every year of continuous combination MHT use. Personal health history. Prior breast cancer. Women with a personal history of breast cancer face the highest risk of recurrence and are generally advised against using systemic hormone therapy. Side effects and adjustment periods. When starting MHT, many women experience temporary side effects like breast tenderness, fluid retention, headaches, or irregular breakthrough spotting as the body adjusts to the new baseline. It's not a fix for lifestyle stressors. This is where expectations must meet reality. MHT will not fix a dysregulated nervous system. It will not reverse the metabolic impacts of a highly inflammatory diet, and it will not replace the foundational need for solid sleep hygiene and strength training to fight muscle loss. MHT should not be prescribed for the primary prevention of heart disease or dementia, nor should it be marked as an anti-aging cure. Beyond MHT, a holistic view. While MHT can be a vital component of managing menopause, it is important to take a holistic approach to well-being during this transition. Lifestyle modifications such as diet, exercise, and stress play a crucial role in overall health and can complement the benefits of MHT. This comprehensive view encourages women to look beyond hormonal treatment and consider all aspects of their health and lifestyle as they navigate menopause. Let's take a closer look at some of these. In the biological communication network of your body, hormone receptors act like locks that require a specific key, a hormone molecule, to unlock and trigger a cellular response. These receptors are located either on the cell membrane or inside the cell itself. Lifestyle factors significantly influence this lock and key mechanism by either supporting the fit, mimicking the key, or rendering the lock insensitive. Factors that inhibit hormone receptors' abilities. Endocrine disrupting chemicals found in plastics like BPA, fragrances like phthalates, and pesticides. These are often called xenoestrogens because they mimic the shape of your body's natural estrogen, disrupting the fit. These false keys can attach to estrogen receptors, specifically receptors in the liver, bone, and adipose tissue, altering your metabolic response and potentially increasing the risk of estrogen-related diseases. Blocking healthy hormones. When these environmental chemicals occupy the receptor locks, they can prevent natural or supplemental hormones, like MHT, from working effectively, increasing the unused hormones in your blood. This can signal to organs to produce even more or stop production altogether. Stress and receptor sensitivity. Lifestyle-induced stress can lead to estrogen receptor insensitivity overstimulation. When hormone levels are chronically high due to excessive supplementation or chronic stress-induced cortisol, the receptors may stop responding properly to the key, effectively jamming the lock. Insulin resistance. Similarly, in insulin resistance, your muscle and liver cells become resistant to insulin. Even though the key, insulin, is present in the blood, the lock or receptor on the cell membrane fails to open the door for glucose to enter, causing the sugar to be redirected to fat cells instead. Lifestyle factors that maximize hormone receptor abilities, exercise, and receptor uptake. Physical activity is a primary lifestyle tool for maintaining healthy receptor functions. Boosting locations. Because mitochondria and muscle fibers are replete with hormone receptors, regular aerobic exercise and resistance training can maintain the locations where these lock and key interactions occur. Clearing the system. Movement also helps the body sweat out toxins from EDCs, clearing the environment so your natural hormones can bind more easily to their intended receptors. Mediterranean lifestyle. The Mediterranean lifestyle helps manage hormonal shifts of midlife by providing specific bioactive compounds that interact directly with hormone receptors and by supporting the cellular environments in which these receptors function. The Mediterranean eating plan influences hormone receptors in the following ways. Interaction with plant phytoestrogens. The Mediterranean eating plan encourages the intake of plant foods that may contain phytoestrogens. These plant-based substances have hormone-like activity and can bind to both alpha and beta estrogen receptors, potentially helping alleviate vasomotor symptoms such as hot flushes. Direct binding to estrogen receptors. Extra virgin olive oil, a hallmark of the Mediterranean diet, contains minor compounds that have the unique ability to attach to estrogen receptors located throughout the body. Hormonal adaptation. By binding to these receptors, extra virgin olive oil helps the brain and nervous system adapt more effectively as natural estrogen levels fluctuate and decline during the menopause transition. Bone health. The polyphenols in extra virgin olive oil that bind to these receptors provide protection against osteoporosis by improving inflammatory markers in the bone and supporting bone density. Maintenance of muscle receptors. Maintaining muscle mass, preventing sarcopenia, is vital because type 2 muscle fibers are replete with estrogen receptors. The Mediterranean diet provides the necessary micronutrients like magnesium and calcium and adequate protein to support muscle density and function, thereby preserving the locations where hormonal actions occur. Preventing receptor insensitivity. These lifestyle factors help prevent receptors from becoming insensitive or jammed. Managing tachyphylaxis. Excess stress can lead to a sudden decrease in treatment effectiveness called tachyphylaxis, in which receptors stop responding to hormones, reducing inflammation. The diet's focus on anti-inflammatory foods like celery, berries, and walnuts help combat inflammation, which otherwise contributes to the metabolic chaos that disrupts receptor signaling. Insulin sensitivity. By favoring complex carbohydrates, the diet improves insulin sensitivity. This ensures that insulin receptors on muscle and liver cells remain responsive, allowing them to uptake glucose effectively rather than redirecting it to fat storage. Critical factors for safer use. Modern management focuses on several strategies to maximize benefits while minimizing risks. Caution with compounded hormones. Medical societies generally do not recommend custom compounded bioidentical hormones because they lack the rigorous safety and efficacy testing of regulated body identical MHT. Dietary interactions. Grapefruit can inhibit liver enzymes and potentially increase estradiol levels to unsafe ranges for women, more intensely for women taking oral doses than those using the transdermal patch. When the enzyme is blocked, your body cannot metabolize estradiol properly, leading to a buildup of the hormone in your bloodstream. MHT should not be viewed as an elixir of youth, but as a targeted medical tool. Other alternatives for managing symptoms include psychological therapies, specialized medical treatments, and targeted lifestyle adjustments. Cognitive behavioral therapy, or CBT. Purpose-designed CBT is highly recommended as a non-pharmacological treatment. Systematic reviews have shown that it reduces the frequency and severity of hot flushes and night sweats, while also improving sleep disturbance and quality of life. Clinical hypnosis. This technique is recommended for its significant efficacy in reducing the frequency and severity of hot flushes. Studies show a reduction of over 70% in subjective hot flushes after 12 weeks of treatment. Lifestyle and nutritional strategies. Whole soybeans contain plant estrogens that can imitate the body's natural estrogen, which drops during menopause. Research suggests that eating half to 1 cup of soybeans daily can significantly reduce the frequency and severity of hot flashes. How soy helps hormone balance. Phytoestrogens bind to estrogen receptors, modestly easing vasomotor symptoms. Gut bacteria conversion. The isoflavones in soy are converted by gut bacteria into a non-steroidal compound heavily linked to reducing hot flashes. Bone health. Prolonged daily consumption may also help slow bone loss during menopause. Dietary tips and considerations. The best sources. Opt for whole and minimally processed soy foods such as edamame, tofu, tempeh, and soy milk. Potential side effects. Adding too much soy to your diet too quickly can cause intestinal discomfort. Medical caution. Individuals with a history of estrogen-sensitive cancers, uterine fibroids, or endometriosis should speak to their doctor before significantly increasing their daily phytoestrogen intake. Breathing and yoga. Slow breathing techniques, 4 to 10 breaths per minute, and yoga can help manage blood pressure and balance the autonomic nervous system, which in turn can reduce hot flushes. Temperature control and sleep. Optimizing the sleep environment by keeping the head cool, like with a fan, and maintaining a cool core body temperature can mitigate night sweats. Wearing layers allows for variations in body temperature as well. Meal timing and protein intake. Consuming large amounts of animal protein late in the evening can cause the body to overheat. Shifting primary protein intake to lunch and eating a lighter, earlier dinner can help reduce nighttime heat. Weight management. Hot flushes are often more prevalent in women with metabolic syndrome or increased visceral fat. Note on other remedies. According to some sources, clinical trials have found that acupuncture and certain plant-based supplements often show no more benefit for hot flushes than a placebo. According to the National Institutes of Health, while herbal options like black cohosh, soy isoflavones, and evening primrose oil are widely popular, clinical studies indicate that the evidence supporting their efficacy is weak or inconsistent. Some can also interact dangerously with other medications, so consult a physician before trying them. The importance of a personalized approach to MHT. Not all women experience menopause the same way. Thus, MHT should not be a one-size-fits-all solution. Factors such as a woman's health history, symptom severity, and personal preferences should be considered when deciding whether MHT is the right choice. This tailored approach helps ensure that the therapy aligns with the individual's specific needs and health goals. In summary, MHT stands as a valuable option for many women experiencing the challenging symptoms of menopause, offering a pathway to relief and improved quality of life. I want to emphasize the importance of individualized care, informed decision-making, and integrating MHT into a broader holistic approach to health during menopause. I want to empower you with the knowledge and support you need to make the best choices for your health and well-being. Ultimately, my friends, the choice to use menopausal hormone therapy is a deeply personal piece of your midlife puzzle. It is not an all-or-nothing medical mandate, nor is it something to be feared blindly based on outdated data. Remember, one important part of the research is that you were likely not part of the study. You have unique DNA, health, environmental, and lifestyle factors that might not have been considered in the science. This is where compassion comes into play. Allow yourself the time to find what works best for you. You know your health history. You live in your body. Your individual needs are important. Your health care matters. You have divine worth and value more than you can comprehend. True confidence in midlife means looking at the science, tuning out the social media noise, doing a thorough audit of your own symptoms, and working with an informed healthcare practitioner who views you as an active partner in your care. You are the expert in your own body. Now, let's take a moment to find some calm amidst the chaos. Allow yourself this time to pause. Place a hand on your heart. Take a deep breath. Feel gratitude and give yourself a 20-second hug and thank your body for her continued strength, embracing your inner power. Thank you for turning into Midlife in Motion. Keep educating yourself. Honor your biology, and remember, you were born to bloom gold. See you next week. You are building a foundation for the next 40+ years of your life, brick by brick, breath by breath. You are a miracle. Treat yourself like one. If you know a woman who needs to hear this, please share this episode and remember to subscribe. I'm Angie Collingwood. Keep moving and dancing. This is Midlife in Motion. I'll see you soon.